Hi, everyone, and welcome to our webinar here tonight focused on hunger, COVID-19, and racial equity. My name is John Wogman, and I am the CPO here at Food Recovery Network. And I am very thankful that we have so many amazing panelists here with us today. I wanted to thank you all for joining us for our conversation tonight on hunger, COVID-19, and racial equity. This is the first discussion in our food justice learning series focused on hunger, food waste, and sustainability. So each month there's going to be a different topic that FRN is putting on, and we encourage y'all to continue along this series. And as you know, our students with Food Recovery Network are doing impactful work all over the country, and this is the largest student-led organization fighting food waste and hunger. And before we get started tonight, I did want to just acknowledge that 10 years ago today, the first FRN food recovery actually took place. So FRN didn't officially exist yet, but rather a group of dedicated students saw that food waste was happening in their kitchen and that people were at risk of food insecurity in their community. And they put those pieces together and really problem solved to address two issues with one solution. And this is how the concept of Food Recovery Network started. And that was 10 years ago today, which is just pretty amazing. So congrats to all the founding members of Food Recovery Network and the thousands and thousands of students over the last decade who have been a part of this movement to ensure that no one in this country is going food insecure and that we're building sustainable practices so that that food waste doesn't exist. And I think that these topics that we're talking about tonight are so important and so relevant to what's happening in this country right now with the pandemic, with the history of racial injustice in this country. And really, we're hoping that, this is a start of a conversation to think critically about issues that intersect with food waste and hunger. And for tonight, I'm really hoping that we can think about the ways that we analyze problems, that we influence others, and that we're able to leverage resources to address issues related to food waste and hunger. And we also want to be thinking about how do we build an equitable and sustainable world. And one thing that I want to share before we get started tonight is a definition of equity, of racial equity, from an organization called PolicyLink. There are many definitions of racial equity out there, but I figured it would be helpful to share this from PolicyLink. So PolicyLink states that a racially equitable society is one in which racial disparities in health, education, wealth, and other areas do not exist. So a racial equitable society is one in which disparities along race, across health, hunger, education, wealth, the environment, they do not exist. And tonight we're going to start having those conversations around hunger and what that looks like. And we're very, very lucky to have two amazing speakers here with us tonight. So I'll do a quick intro for Parker Gilkessen, who is a policy analyst with CLASP's Income and Work Support Team. She works with low-income and work support programs with a focus on the Supplemental Nutrition Assistance Program, SNAP. And Parker holds a Master's of Public Policy with a concentration in public administration, and also a Bachelor's in Health Education, Maternal and Child Health. And she has, she's a subject matter expert in social policy, human service delivery, racial equity, policies regarding SNAP, TANF, and Medicaid. And she really, values the importance of bridging the gap between the policy analysis and policy effectiveness. And she's incredibly passionate about creating change. And our second speaker tonight is Melanie Pang. She serves as the Director of Advocacy with the Houston Food Bank. And for the last 10 years, Melanie has worked in service organizations to provide support to refugee youth, people who are experiencing homelessness, and people affected by the foster care system and those experiencing food insecurity. Melanie is an incredible advocate. She's also just someone who's really pushing for equitable policy change and is also thinking about different levers of change that she can advance through her work at the food bank, through her work as an organizer, through her work as an advocate as well. And in 2015, Melanie was named the Social Worker of the Year by the National Association of Social Workers in Houston, and then received the President's Award for Distinguished Community Leadership from the Houston GLBT Political Caucus in 2016. So we're super thankful that these two amazing speakers are here tonight with us. And before I turn it over to Parker, I did want to say that we will be having a Q&A section later on tonight. So if you have questions, please send them our way to the Q&A portion here, and we'll be diving into those questions later on. But yeah, keep them coming for us. We definitely want to make sure that we're hearing what y'all have to, what your questions are, and get you some answers from our amazing panelists. So with that, thank you everyone. We are going to dive into the topic of hunger, COVID-19, and racial equity. And I'm going to turn it over to Parker, who's going to talk about these issues from a national level.
All right. Hello, everyone. So my name is Parker Gilkessen, and I am a policy analyst on the Income and Work Supports team at the Center for Law and Social Policy, or better known as CLASP. So on our team, we work on issues spanning public benefits programs, and I particularly, just like John said, work on SNAP. The SNAP program. So today I will briefly discuss hunger, COVID-19, and disproportionate effects on communities of color. So if we could move to the next slide, that'd be great. Thank you. So here's just a brief overview of what we'll be discussing. Then we can head on to the next slide. So, as you all know, the world was taken by storm by the coronavirus pandemic. Millions of people had to shelter in place, lost their jobs, and slipped deeper into poverty. So here I'll talk about some of the ways relief has been provided on a federal level. So the first way is that last year, the Trump administration released 3 proposed rules that threatened to take away SNAP benefits from millions of Americans. Before the COVID-19 shutdown, one of those rules was finalized and expected to go into effect on April 1st of this year. So that rule was to tighten the harsh 3-month time limit on SNAP benefits for adults who are unemployed or underemployed, who don't have children in the home or a documented disability, consequently taking benefits away from over 700,000 folks. So thankfully, on March 13th of this year, a federal judge blocked implementation of that new rule. So therefore, those folks were not at risk of losing their benefits any longer, especially, you know, during a time where folks are struggling to find work even more during the pandemic. So that was an important move. Next, the Families First Coronavirus Relief Act. So in March, not too long after the injunction, the Families First Coronavirus Relief Act was passed, and in the relief package, it prohibits states from cutting people off of SNAP due to the program's time limit. So that was another great thing. Then also, it would only cut them off if they refuse an employment and training opportunity. It also gave $500 million extra dollars for the WIC program, which is the Women, Infant, and Children's program that provides nutrition assistance for mothers of children under 5 years old. And the program also provided additional benefits for families with children, school-age children particularly, called pandemic EBT. So if a school was closed more than 5 days, which all schools pretty much were, then the parent will receive a benefit, on average about $125 per child per month, to really help parents be assisted with food, because oftentimes when you're eating a meal at school, that takes a lot off of parents during the school year. So just wanted to assist parents with assistance for their children. So also next was the Coronavirus Aid, Relief, and Economic Securities, or CARES Act. This is the act that provided the $1,200 economic stimulus payment. It also provided the $600 increase to unemployment benefits weekly. And another aspect that's not necessarily listed here, but that's really important, is that FNS had allowed states to submit administrative waivers to help with whatever their state needed. So waivers like increasing the maximum benefit level all the way, increasing the benefit level all the way up to the maximum for every SNAP recipient that's eligible, or adjustments to interview requirements, extended certification periods, and allowing telephonic signatures. Despite federal relief, unfortunately, hunger has still increased though. So as COVID-19 continues to spread throughout the country, so too is the crisis with hunger, and that's growing as a result of the coronavirus pandemic. Since the pandemic has begun, food insecurity has doubled overall and tripled in households with children. So I'll repeat that: food insecurity has doubled overall and tripled in households with children in the household. So next slide. So we know that hunger disproportionately affects communities of color. However, the COVID-19 pandemic has exacerbated already existing disparate impacts. So if you take a look at this graph, you can see that for Black and Latinx households, they are significantly higher than white households, right? Black and Hispanic households with children are actually 2 times more likely to experience food insecurity than white households during this time. So going ahead and go to the next slide. And there are multiple reasons as to why communities of color experience hunger at a higher rate, but one of those reasons is stigma. The shame and stigma attached to receiving public benefits based on racist stereotypes truly stifle access to necessary help, even during a world pandemic, right? So my background, originally, I started out my career in direct services. I was a social services eligibility worker in the state of North Carolina. And there is where I truly came to understand the deep-seated stigma attached to receiving public benefits. I can't count the number of times where a client of mine would mention that they aren't like those other people, or they just needed benefits to get on their feet because they're having a difficult time, when the reality is, you know, everyone is having a difficult time. And it's nothing wrong with asking for help in the time that you need it. But unfortunately, that's not the case when it comes to public benefits, the perception of it. Harmful racist stereotypes like the welfare queen have had a pervasive effect on American perceptions of public benefits. It's so unfortunate that the story of the welfare queen is used to characterize so many people experiencing poverty, because she actually was a true person, but she was an anomaly. There was much more to her than her quote unquote welfare fraud, if that makes sense. She had been a serial killer, had done a lot of different things that should not be used to characterize every single person that receives public benefits. However, unfortunately, her story has for the last 40 years. And this idea that folks who are receiving public benefits are lying about how poor they are, and they really are. It feeds into the concept of deserving and undeserving, of who is more deserving and who can prove how, you know, much more poor they are, which is absolutely disgusting. And because of these harmful stereotypes and perceptions, there's a shame that comes along with applying for public benefits. Seeking the help you need to succeed, honestly, truly is the greatest form of dignity that there is. However, in this country, getting public benefits is treated like you're now carrying a scarlet letter or a badge of shame, versus just receiving the help that you need when you're in a difficult time. And until we completely expel harmful stereotypes and shift our collective mindsets around people experiencing poverty, the shame and stigma will continue to exist, and that will prevent people from getting the help that they truly need based on the perception of others. So people need health care, food, secure housing, and livable wages in order to live and thrive. These are basic human rights, and it's really that simple. And the sooner we make it that simple and stop politicizing folks' basic needs, I think the better off we'll be. So we can go on to the next slide. So in the anti-hunger community, we have multiple asks that we are trying to put forward to make sure that they enter into the next package. We have not received another COVID relief package yet, unfortunately, but when we do receive one, these are some of the things that we're looking for. So a 15% increase in maximum SNAP benefit amount. So the overall SNAP benefit maximum, we're looking for a 15% increase in that. Also increasing the minimum benefit amount from $16 to $30. And then suspending all proposed and final rules. So remember the 3 rules that I talked about from last year that would take away SNAP benefits from millions of folks, to suspend those rules indefinitely. And then also to extend child nutrition waivers and the pandemic EBT program. And one thing that I will add as well, that although these are asks of the hunger community as a whole, this pandemic has provided an opportunity for us to truly think more deeply about big and bold changes that can be made to the SNAP program to better serve people experiencing hunger. So as you all are thinking and meeting folks and all of those things, it's great to really, really think about what are some big and bold changes, even if they seem like they would be in a utopic world, that will really help people, especially moving out of a pandemic like this, where we don't know when the economic changes are going to end. So I'll go to the next slide. So my charge to you all, as you serve, I charge you to listen and ask yourself these questions. So how are you bringing people impacted by poverty and hunger into proximity to power? Because families who are experiencing poverty know exactly what they need, and we should center everything we are doing on their voices and their activism, right? And not only are we advocating for them, but bringing them into spaces of power where they can use their voices, and we're just passing the mic, right? My second question is, how can you better combat stigma? Like I mentioned before, stigma is a huge barrier to access. It's really underestimated. It's a huge barrier. So how are you contributing to dissolving the harmful stereotypes, not just in your work, but even in conversations with your family and friends, right? Because that's where it all begins, even beyond your work and your service. So my next question is, how are you intentionally thinking about and talking about race? Are you addressing your own bias? Because due to systemic racism, race plays a very real role in economic and health outcomes, right? It's important to address our own racial biases and power structures within your organization or wherever you work that may perpetuate systemic racism. So thinking about all of these things, that is to conclude my short presentation, and I look forward to everyone's questions.
Amazing. Thank you, Parker, so much. And again, for folks who might have joined us, we're going to have a Q&A section after our second panelist. So please send in your questions about these topics, and we will have plenty of time to answer your questions. So I'm going to, once again, thank you, Parker. That was really amazing. And I'm going to turn it over to Melanie. So Melanie, why don't you tell us about your experience in Houston?
Thank you so much, and good evening, everybody. Parker, very much appreciate your work at CLASP. Organizations like CLASP are the way that we are able to advocate at the Houston Food Bank, so thank you for all your hard work. I know it's a relentless churn of trying to update policies and all their impacts, so thank you for that work. So as John mentioned, I'm over at the Houston Food Bank. We are considered to be the largest food bank in the country, potentially the world, based off of distribution. So just this past fiscal year, we've provided 159 million nutritious meals. For some scale, the next Feeding America food bank that comes close has provided 90 million. So just to give you some size proportionality there, we also serve a very large service area, which certainly contributes to it. We serve 18 counties that are contiguous with Harris County, and we have 3 partner distribution organizations and 1,500 network partners that help us accomplish that mission. So our mission is food for better lives, and our vision is a world that doesn't need food banks. And I'm super proud to work for an organization that has acknowledged the fact that yes, we can tackle and fight hunger and food insecurity, but wouldn't it be even better if people didn't need us at all, right? And so kind of the overarching theme of my talk with you tonight is imagination. I want you to be thinking about not just the things that alleviate suffering today, because that's absolutely needed and necessary and we can't stop, but also the things that could radically shift the way that people live, so that we're not just talking about the quote unquote working poor, we're actually making it possible that every person who is working is making enough to live, and even those who can't work have access to dignity. So I hate to throw more stats at you, especially since I don't have a pretty slide, apologies, but I do want to give you paint a little bit of a picture of what's happening for Houstonians and really everyone in our 18 county service area. So I like to frame this in terms of tough choices. So 69% of the people that we serve have to make choices between food and utilities. 57% have to make choices between food and rent or mortgage. Now, you know, if you're thinking about a tough choice, right, food or rent, as my boss says, for goodness sakes, pay your rent, right? Rent is binary. You have either paid it or you haven't, even if you paid 50% of it, right? Unless you have a really nice landlord. But all in all, you're going to take care of that basic need, because that could go away if you don't fulfill it. And so, you know, if we're talking about the intersectionality of various issues, which I hear that a lot of y'all are coming from a variety of backgrounds, I hope this will resonate with you as well, that food insecurity is not just about not having enough food, it's actually about the tough choices that you have to make, right, to make all of your ends meet. 67% of folks in specifically Houston, because we're known for a lot of things and one of them is traffic, you know, 67% of the folks we serve struggle with making the choice between food and gas and fixing up their car, right? And then if you link that even to policy, SNAP has an asset test in which a car is an asset. And in a place like Houston, Texas, where we have some of the most stringent SNAP regulations, the expectation is that you would sell your car so that you would have enough to eat, which is extremely short-sighted, right? And so the idea that you would get a decreased amount of SNAP simply because you have an asset worth a certain amount of money, well, that asset is your lifeline in a place like Houston that doesn't have public transit as built out as many other cities do. So, and my last one, making trade-offs between food and education. So 31% of our client base struggles between making the choice between food and education. Now, every politician under the sun would tell you that one of the biggest keys to getting out of poverty is a good education, right? Well, if you're having to make the decision between your own nourishment and health and advancing your degree and your work life, you know, how far can you really get? Knowing that these are all the choices that are having to be made even before COVID-19 was an issue. You know, the way that this has exacerbated the inequities and inequality is devastating. So right now we estimate that we have 1.1 million people experiencing food insecurity in our 18 counties. Post COVID-19, we're anticipating that it's somewhere actually around the figure of 2.75 million. So more than double, almost triple within our region. And that's just what we know of, right? As Parker talked about before with stigma, people would much sooner hide the fact that they needed help than to be counted as somebody who might need services. So, talking a little bit more about COVID-19, we've had to shift the way that we do our food distribution. So we couldn't just keep our choice pantries open, which provide a lot more dignity, provide people the opportunity to walk around and shop, pick out the items that would best suit their family, best suit their needs, because grocery stores were also under the same restrictions of, potentially not being as safe. So we've actually had to move to a model that would accommodate a large amount of people and accommodate a very small amount of people. So one of those methods has been home deliveries. For folks who can't get to the grocery store for one reason or another, we've been able to transition to that model. But as you can imagine, being one of the largest food banks in America, having to ramp up that operation so that we're doing enough deliveries a day, there was a rocky start, right? And it continues to be a bit of an uphill battle because, while we pride ourselves on the fact that we're trying to expand food access, that means more 18-wheelers on the road. That means more money for fuel and gas. That means, there are a lot of other implications in that. And then we talk about, the large scale. So, with nearly 3 million people who are going to be needing food, groceries, we needed to scale up. And so we got the largest stadium in our city to allow us to use their parking lot as a way for folks to be able to cycle through and have these touchless food distributions, which are innovative and great and all of those things, but they also take away from our interaction with these individuals to be able to hear their stories. So in trying to find the balance between feeding more people more efficiently and quickly to also better understanding their needs so we can be planning for the future, a lot of times the efficiency and the faster, larger scale method is what wins out. And so, we understand that as a food bank, we would love to be able to be building more infrastructure to be able to better understand who we serve. But that said, organizations like CLASP, organizations like the Food Research and Action Center, they do have the data to tell us that, yes, food insecurity is an issue with BIPOC or Black, Indigenous, people of color communities, not on the merit of skin color or anything of that nature, but because of all of the systemic barriers that have always kept those communities from prosperity. So, if I look at if we look at our population of clients, 2/3 of them have at least one working adult. Now, when COVID-19 hit, those of us who could do our jobs from home or were salaried had somewhat decent job security, right? But what are the first jobs to go? The hourly wage jobs. Oftentimes, folks who already were kind of in an unstable situation to begin with may have been paid cash or things of that nature, right? Specifically folks in the food industry as well. And so if we think about who all works in hourly wage jobs, predominantly they're BIPOC people, right? Now, more visuals. I gotta get better at visuals, John, but hopefully finger circles will work for now. So if I'm creating the Venn diagram of who the Houston Food Bank serves, right? There's folks who are struggling with food insecurity. And then we think about COVID-19 and the people who are affected by that disaster, right? And then I layer on folks who are experiencing challenges because of Hurricane Laura or now Hurricane Sally. And then I layer on folks who are facing eviction, right? Because of all of these job losses. As the memes say, the Venn diagram is a circle, right? These are all the same communities. And so part of why racial equity is such an important piece of our work and hasn't been but needs to be forever is that if you're creating programs for a community and you're not including them and centering them and really relinquishing your power and having them guide you on what is best, you are literally just guessing. You are making maybe an educated guess, but you are still creating a solution that could be very short-sighted, or, as I like to say, it'll work for who it works for. So here's an example that the Houston Food Bank did. These drive-through food distributions, they work really well in terms of, we were able to serve at our peak somewhere around 9,000 cars in one day. That's incredible, but what about folks who don't have cars? Or enough gas to sit in line for an hour or 2 hours, or enough gas to get them across town because Houston is huge, right? So it works well for who it works for, but have we considered all of the aspects, right? And so then that's when we had to build out home delivery, and that's when we had to build out a walk-up tent and create a portion that makes sense for them to carry, right? Because the 60 pounds we were putting in the truck don't make any sense for somebody who's walking up from the bus stop. So there's so many things that need innovation. There's so many things that need imagination and need inclusion for them to be useful, sustainable, productive, right? This last thing, and then I think I can be quiet, is, I talked about imagination before. We work with retail folks. We work with the everyday person who's, taking items out of their pantry and donating them to us. We get donations from, we get product from USDA. We get product from all these different areas. And then it comes to our food bank and we've got to sort it, make sure it's still edible, make sure it's nutritious, right? And that takes volunteer power. That takes a lot of people power. Once we've done that, it then has to go out on trucks, which then takes a lot of gas. It takes a lot of other resources, time, skills. Once it gets to the destination, it's got to come off the truck, be bagged, sorted, and then handed out by the partners' volunteers. Even more people power. All of that happening is a small miracle that it logistically gets done, especially on a nonprofit budget, right? All of that is an incredible undertaking. But wouldn't it be great if people could go to the grocery store and get the food they need for their families, right? SNAP is not our end-all be-all for sure, but when you increase SNAP, you increase people's cash in their wallets. You increase their potential to spend on other things that matter and make a difference for them. So when we're talking about efficiency, Houston Food Bank's got logistics efficiency all day, but that's not who it should matter for. It should matter for the person who needs the food right now. So the most efficient route is policy change, even though policy change takes longer than maybe sending a truck out, right? So these things are all kind of in competition with each other and kind of hard to balance, right? But we can't stay focused on the short-term solution that we think of as more efficient, when actually what's more efficient for the people who need it most is for us to change our policy. So when I say imagination, I'm also talking about compassion. If I think the most compassionate thing to do is choose your groceries for you and deliver it to your door, fine. But I would love to live in a world where the most compassionate thing someone can do is fight for my right to have better. Right? So I had no idea how much time I was supposed to be allotted for this, but I'm sure that the Q&A section will be robust. Is there anything that you'd want me to highlight, John, or did I kind of hit everything?
Yeah, so that was amazing. And Melanie, thank you so much. And the commitment and the power of imagination is something that we definitely need. And you and Parker, there's so many themes that I'm really excited to hear what our students and folks on the call have questions about. So again, it's another reminder, please send in your questions for Melanie and Parker. Yeah, thank you both so much. And these issues the issues of racial disparities in this country have existed since the founding of this country. We're dealing with issues related to climate change. I mean, the West Coast, there's just a multitude of fires that's impacting the health and livelihood of folks all across the country, and not to mention the climate impacts that are happening as well. And then the Gulf Coast and the amount of flooding that is happening in Alabama and Florida right now. And I'm just, wondering with the urgency of the now, with the issues related to hunger and addressing the immense racial disparities in this country, coupled with the pandemic, what have the two of you found as advocates really effective to influencing others and getting them to agree with you and your point of view and why you need, to advocate for SNAP and how important that is as a program. So yeah, what have you found effective in getting people to see the urgency of now?
I would say, and I've always done this anyway, all my walks of life. But I would say, first off, Melody, thank you so much for saying everything that you said, because imagination is just it. That is it. How can we imagine what is better than right now? Because I think oftentimes we get stuck in systems, we get stuck in what works for us, right? We get stuck in, well, this is my job and, this is the best that we can do. But how can we, once again, advocate for making sure that people can actually do what's best for them? And how can we make sure that we center everything on the people who are impacted, but on trust? That is such a big, big deal. Because like when I talked about stigma and things of that nature, a lot of systems that exist right now, even the SNAP program is an awesome program, but the things that people have to go through to actually apply for the program, the things that people have to go through being overly policed by the program, it almost isn't worth it for some people, right? And in the advocacy world, I think because of COVID-19, thank you, hallelujah, because I've been talking about a lot of these things for a long time, but I think this is finally waking some people up. Some people who are perfectly fine with the status quo, which is very uncomfortable because most folks who are perfectly fine with the status quo, you're not receiving any public benefits right now. This does not affect your life, right? And something being your work is one thing, but when it affects your life, it's a total different thing. I like how an advocate out of Florida who advocates for re-entering citizens to be able to vote. I think his name was Damon or Damien, something like that. But he mentioned a ham and cheese omelet. And he said how the pig is really committed because of the ham, right? But the chicken is not as committed with giving the eggs. The cow isn't as committed with giving the milk, right? But folks who really are living this as their lives, they have to see the change, these small incremental changes that our policy world is hooraying for. In their lives, this increase means nothing, right? And I almost feel like sometimes it's difficult to bring folks who are deeply impacted because it's almost a rain on the parade, right? Because it's like, we need to do more. So I will say I'm grateful that the pandemic, even though it's so unfortunate, has truly shined a light on the fact that we need to do more. It has shined a light on the fact that, yes, this administration has done some absolutely horrendous things, but for people of color, a lot of these things have been existing before this administration, right? And it's time that we start doing big changes instead of small incremental changes.
Totally agree. And Parker, I feel like if you're ever in Houston, let me buy you a drink or whatever makes you happy, because yeah, it's always the right time to do right? So MLK's quote, but also like we can walk and chew gum at the same time. We have to, if people are starving and hungry today, I'm not saying, no, 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 wait till policy change to feed people, right? Like, we still have to do what we do on a large scale to make sure people can eat today, that families get fed, the kids get fed, seniors. But without the systemic change, we'll be doing this forever, and it will only get bigger and bigger. So for the past 30 years, we found that feeding people hasn't ended hunger. The data shows that hunger has only increased. We thought that by taking food waste over here and putting it where folks don't have as much access, that was going to magically resolve this issue. Logistically, makes sense. On the ground, in practice, we've not seen that play out, right? And there's such a variety of needs. There are people who, are trying, well, I could go down that path all day long. I know y'all already know this. But back to what Parker and John are talking about like what works. There are some people who will listen to a business argument. And for anyone who knows it, so a dollar in SNAP generates $1.79 in economic impact. So SNAP dollars get spent somewhere, and those businesses are local, right? So even though it's a federal program, this has great local impact. And if that means if people aren't getting SNAP, they're not spending it in grocery stores. If they're not spending it in stores, those stores aren't going to get the great business that they need. Walmart has incredible foot traffic solely on the basis of SNAP. And just a little bit of myth busting at the same time, there are only specific things that you can purchase with a SNAP card. Now, if you're in the state of Texas, that card is also the same card that TANF, Temporary Assistance for Needy Families, which needs a rebrand, is also on the same card. And so a lot of times when people are swiping and they're using the cash from TANF to purchase certain items, people perceive that to be about SNAP dollars, and it's not. So back to what Parker was saying about misconceptions about how SNAP dollars are used, it's all over the place. So a business argument about saying that this is going to locally impact, create jobs, keep folks at least working toward a wage that can sustain their families, sometimes will open the door. But if it's an ideological thing, to me personally, it's a lot less about me trying to change your mind, right? It's a lot more about who can I put in front of you that you will listen to, who has had these experiences either in their past or are experiencing it today. Could be their own coworkers, right? Think about all the staff at these airlines, right? There are major companies right now that are hurting because of this, and they don't want to see their employees have to be laid off or be struggling with these other needs. So I think there are a multitude of ways, depending on who you're talking to make a greater impact. But also firing up folks who agree with you to talk to people who don't necessarily think about that issue all the time. It's super important. Don't just stay in your bubble.
Great. Thank you both for those responses. Just another reminder for anyone who has questions to send them into the Q&A. And I'm also going to introduce Sydney Carroll, who is a fellow here at FRN, and she's one of my colleagues here and one of the collaborators on the planning of this event. So Sydney is going to walk through additional Q&As here and ask questions of Melanie and Parker.
Yes, thanks for the introduction, John. It's really great to have both you and Melanie and Parker here with us for our very first webinar in this social and food justice learning series. So thank you very much. Like John said, make sure you send in your questions in the Q&A function. And I have a question for both of you. So as you've both talked about, several things in our daily lives have changed since the pandemic hit. And for some of us, that includes how we access food, whether it's like school shutdowns, not being able to get that free breakfast, or even working in food service, not getting your daily family meal when you are on shift. So I was wondering, in your opinion, what pandemic adaptation that we've had to make in our lives has been the most detrimental for food access in communities that are already at high risk for food insecurity?
I'll start since Parker went first all the other times. Yeah, the first one that comes to mind for me is the National School Lunch Program, right? So when schools had to shut down to think about how they were going to approach COVID-19, there were so many kids who relied upon those breakfasts and lunches and afternoon snacks every day. And so, you know, the model of going to a food distribution and waiting in line in a drive-through, essentially, waiting for that food was not really all that sustainable or really all that efficient, right? Because if we're talking about 2 or 3, you know, 2 meals and a snack a day times all of those kids, you know, maybe you've got several kids in the car, you're not going to do that every single day, like you mentioned, Sydney. So we had to adapt to a program called, in the summertime, there's the Summer Food Service Program, SFSP, and we had to move it to SFSP at home. And so we had to work with our school districts very closely, get those lists of kids who would typically rely on these meals, and find a way to deliver them to their homes. This is a massive undertaking, right? We're talking about one of the largest school districts in the country, HISD. Another big gap is that, you know, we had, well, when those schools closed and then reopened, we've had a drop off of enrollment in school. So there have been like 11,000 kids in HISD that just haven't come back, as far as we know. And so those kids are probably the most vulnerable, who probably didn't even have the resources to have the virtual option of school, let alone the access to meals. So I think there are still a lot of unknowns in this crisis that we're going to be learning about in the next months or years to come. Yeah, there's a lot that's changed about how we can even get to food.
I would definitely say, and thank you for that, Melanie. One shift that had taken place was that the SNAP program had a pilot where you could use EBT benefits to order online, but there were only 6 states that were participating in that at the time. And thankfully, FNS has moved a little faster to be able to allow folks to order online. However, the only stores that allow online ordering are Amazon and Walmart. And for a lot of folks, Amazon uses Whole Foods, which is extremely expensive. And then Walmart, contrary to what a lot of folks believe, Walmart isn't everywhere. You know, in a lot of rural areas, or even I know when I first moved to DC, there was no Walmart, only further out into Maryland. So that was one thing for sure. Another thing that one of our activists that we work along with at CLASP, she mentioned that she noticed a sharp increase in the cost of food during the pandemic. So although, you know, she was able to receive SNAP benefits, they went a shorter distance when it came to purchasing food for her family, but they went a shorter distance and her children are home. There have been issues with some states with folks receiving the pandemic EBT. It's been a huge undertaking for a lot of folks. So I would definitely say that that's a change that's happened as well. And with folks sheltering in place, especially for people who already had illnesses or already were really vulnerable, it was very difficult because not every state is like Texas, where you all were delivering meals, my God, because the school lunch participation rate was very, very low in a lot of states for families going to pick up and not purchase, but pick up meals from their school. Because first off, we're trying to shelter in place, right? The meals that were able to be offered weren't, I don't want to say weren't the best, but they weren't what people desired. So that is definitely some things to keep in mind.
Can I piggyback on that, Parker? Okay. When we're talking about food that is maybe not exactly what people wanted. I cannot tell you enough. Food banks give out what we get, and we are given donations, right? And so that cream of corn can, or that, you know, box of cereal that you maybe not wouldn't have bought, but somebody else did, right? So yeah, I can't tell you how much the next maybe frontier of food bank work has a lot to do with culturally sensitive food items, right? If I'm sending a truck of bok choy to one community, I better be putting a recipe in there, right? So people know how to cook it, what, you know, have it be nutritious and useful to them, as opposed to just sitting in their fridge and rotting. And so if we're talking about food waste, we need to also be thinking about, you know, equitable, culturally appropriate food, so that that food is still not going to waste simply because it's not what's suitable for that family. So yes, the food variety and selection is super important, and it's oftentimes a thing we don't have control over.
Yeah, I wanted to echo Melanie and say thanks for bringing that up, Parker, and thanks for expanding on it. That's an issue that our network is aware of for sure. We find surplus food where it exists, and a lot of times that's in Einstein's Bagels. And so our chapters will end up donating hundreds of pounds of bagels to a food pantry in a year, and that's not necessarily the highest need. So we're always in conversation on how we can find out what the food pantry needs and find the surplus that exists to fit those needs, and how we can use, for example, hundreds of pounds of bagels in a different way, like the university or Ohio State University. They're turning their bagels into beer, which is pretty cool. But to move on to the next audience question, Yesenia has a really great question about the intersection of government and nonprofits. They say food insecurity is largely a silent issue in the United States due to heavy stigma surrounding the topic. Many Americans do not realize this issue is happening in their backyards. How do we bring this issue up to politicians, and that they actually use compassion in their policymaking instead of just relying on charities as short-term solution?
That's a great question. I would definitely say that hunger has been a silent issue, and that's partially why the SNAP program came about many, many years ago, when certain legislators went and visited rural towns and saw that people's cupboards were completely empty, and how children were going hungry and things of that nature. So I think as Melanie and I continue to talk about centering folks who are deeply impacted and centering their voices, that is really what helps people to recognize that it's happening. But it is very hard to do that, particularly concerning hunger, because then when you speak up, right, you tell someone your story, they can, one, do anything they want with it. It may not necessarily have the best intention. You may be labeled forever. I know some folks who have been in documentaries before, and they have received great backlash within their communities because of it. So just thinking about all of those things, it's important to keep people centered. And it's important also too that as we're going and speaking with legislators and things of that nature, oftentimes it's hard to not just talk to them about what they want to hear. It's hard to not just talk to them about what they would best be willing to go for. But it's time that we start entering into a space of really saying what is right. And it also doesn't just start with the legislators either. Legislators go based off of what their constituents want oftentimes, right? And so I always like to talk about how we have to really start having not only media campaigns, but conversations within our own families and within our own friend groups and within our own social groups, because we underestimate that often. I think we all the time think that, oh, I need to go and talk to this legislator and change their mind, when their mind will be changed when all of their constituents are saying the same thing, right? But oftentimes the stigma and the stereotypes that legislators are thinking about, so are a lot of us. And that's something that we have to absolutely address. If we want to address food insecurity, if we want to address hunger, if we want to address poverty, really think deeply. What were you told growing up about folks experiencing poverty, right? What narrative were you sold? How did you feel if you personally experienced it? And as we start there and start to really address those things, and start to think about it where we simplify, just like I said at the end of my presentation, food is food. Food is food. You need food to thrive. You need work to live. You need, sustainable housing. All of these things are simple, basic human rights. And they should not be fought over based on what political side someone is on, right? And the more we normalize that and continue talking about it, that is how it'll be easy to go in to speak with a legislator, because like I said, their constituents will be on the same page.
Ditto. And I would recommend, getting to know that legislator or that policymaker well enough to know what committees do they sit on. So they might sit on something as seemingly mundane as infrastructure, transportation, or something like that, right? Link your issue to the thing they care about and make it super clear how those things are tied, right? So what is irresponsible for the environment is irresponsible for housing, right? Who cares how much affordable housing you build if you build it in a swamp and then it gets flooded? What's irresponsible for housing is going to directly impact food insecurity if people can't afford the rent. So, draw those ties together so that they will start to think of food and, right? It'll always be food and my issue. And you'd be surprised that, you can talk to your policymaker about how much political cover that this issue can give you, because everyone knows what it feels like to feel hungry. Not everybody knows about those other issues that are, devastating, but also, specific to certain populations. So I recognize we're low on time, but I just wanted to highlight that.
Great, thank you. We've got about 10 more minutes left for questions, and so I'm going to wrap this up into one question here. We've got one from Katya and one from Susan. The first is about impacting policy change to address food insecurity and what we can do now to impact food insecurity in our local communities. And the second question is very similar, of what forms of advocacy can individuals take to raise awareness or incite change? And then once we are doing that work, how do we know that our efforts are actually making change?
So so twofold, right? So how to affect change and then how to know it's working. So in our work, we're still very new as an organization to this space, although we've been doing advocacy for a very long time with our state associations and all of that. So that caveat aside, I like to think that your most effective approaches will be the things that you're an expert in, which is your own life, right? And the people who are most affected by this issue are going to be the experts. So if there are food distributions that are happening in the area, let people know, hey, you've got about 500 constituents who line up here every week. Maybe you want to come check it out, right? Maybe you want to come out here and be seen with them. Maybe you'd like to help pack some boxes, right? That's a great opportunity for them to, as icky as it might sound, for them to be able to get their photo op, get their opportunity to be seen with the public, doing something really helpful and meaningful. And meanwhile, you got them and their captive attention, right, to talk about the issues that are really important to you, and saying like, these folks come here every Saturday and I know they don't want to, and like bring over some key people to come talk with that policymaker, right? And then as they're leaving, kind of talk to them like, so what do you think are some great solutions that we could work on together, right? Nobody likes to be told, this is your problem now. So always talking about, well, here are some things we're doing. Would you like to join us in that? Or what are some of the priorities that your office has that we might be able to partner on? How you'll know it's changing is by how many conversations that elected official will still have with you after that. I can't emphasize enough the importance of staff. The elected official can only be an expert in so much. They rely super heavily on their staff. So if you can get a champion on their staff to take up food as one of their issues that they care about, that you are constantly talking with them about, sharing your news, sharing your updates, saying, hey, can I add you to our newsletter, right? Keeping it on the front of their minds is super important because they're bombarded with issues all the time. Final thing is, hunger is one of those issues similar to homelessness, where people say, well, it's never going to go away. Well, does that mean that we have to have it be 3 times as bad? Right? So I think part of the challenge around issues like hunger and homelessness is it's just always in the back burner, that people think that there's not an urgency to it. But if you start to think about the eviction pandemic that is beginning right now, we've had, just in Houston alone, over 2 million people apply for unemployment just between the months of April and June. 2 million people applying for unemployment. So yeah, just trying to find those data points that might also create some urgency around an issue that people think has been around forever is going to be super key.
That was great. Can you repeat the question again really quickly?
Sure. So it's kind of a combo question from 2 different attendees, but they were asking how to impact their local community in terms of policy, and also how to be an advocate and build awareness around food insecurity and the intersecting issues, and know when those advocacy efforts are creating change.
Gotcha. I'll take, because Melanie took the first part of the question so good, I'll take the second part about how to be an advocate. And I feel like you all are doing it now through serving. That is the greatest way to be an advocate. Before trying to step out and and make a great change and all this stuff, you have to serve. That has been the foundation of the work that I do now. I served for a long time. Even before I worked for social services, I served. And in serving is where you will find, and where you will talk to folks, and where you will see what is really happening and what are the true issues. And then that's where you can really advocate and be a bridge, what I like to call it, if that makes sense. And change takes a long time. Change does. There are some things that you will quickly be able to see. And then there are some campaigns that some states literally have been trying over and over and over again. And the tricky thing about change is that it's easy to get wrapped up in, let me do whatever will help us to see something. And I think that's also a part of just the, nonprofit complex, if that makes sense. However, it's really important to know for yourself, what is the change that you want to see? What are you hearing from folks? I know my old clients and folks that I still work with to this day, they constantly are ringing in my head, and that is holding me accountable, right? That is holding me accountable to make sure that this small incremental change wouldn't mean a doggone thing to them. So even though it's uncomfortable, I'm going to speak up on the things that I know that are necessary, because I will be in rooms that everyone will not be able to necessarily be in. Now, when I get my foot in there, I'm bringing some people with me, okay? But what I will say is that if I'm in there by myself, I'm still going to make sure that I'm not just harping on something that'll sound good, or that, maybe this will be what works. No, what is right? What do I know? What have I seen with my own 2 eyes? What even have I experienced myself? And that is how you truly advocate, if that makes sense. And how am I passing power also, too?
Thank you both. And as our final question, I would love to hear a piece of advice that you have for our network, for the young people here trying to make change in the food system and in the realm of social justice. What's a piece of advice that you might have for us?
Okay. We already talked about imagination. We talked a little bit about reflection, right? That it's really hard for you to walk up to anyone really and convince them that you're about change if you've not changed yourself. So thank you, Parker. I can see the affirmation. And then I just also want to say, you know, and maybe this is just, you know, soft underbelly Melanie talking, but build your own resiliency. There is a lot going on in the world right now. And to continue to immerse yourself in all of the bad is not going to make you the best vessel for service, right? Find the things that give you hope, find the things that fill your cup, and make sure you have just as much of that as you do when you pour, right? Like fill as much as you pour. And in terms of college in particular, I enjoyed being in an environment of learning and an environment where I can mess up. And so know that you don't have to do your advocacy perfectly, but doing it at all, it develops that muscle so that the next time you do it, it's muscle memory, right? And then you create habits of advocacy. You create a habit of standing up for yourself. And if you want to talk about food insecurity in college campuses, which is a growing issue, collect data and throw it back to your chancellor and say, hey, I don't know if you know this, but 40% of your student population is having a hard time finding a meal right now. What are you going to do about it? So that's Firestarter Melanie, Melanie's advice for hopefully a life full of advocacy in the future.
Yes. Okay, that's what I'm talking about, especially when you were saying start with yourself. That is the truth. If you have not changed yourself, how dare you go try to change somebody else? That's not gonna work. So I love it, Melanie. But what I would just go back to is just learn how to listen. Learn how to listen. We don't have all the answers, and we shouldn't. We are just a bridge. And the easier we understand that, the better we'll be able to actually help change. Because sometimes, and this is in every organization, every structure, every government, but there are structures of power. And sometimes when you get into a structure of power, it's like, well, I'm the one calling the shots. I should know what's best. No, you should listen. Become a great listener. And when you become a great listener, also understand when there are times when it's time to pass the microphone. Like my homegirl Diane Sullivan always says, she's an activist out of Boston. She's always saying, pass the microphone. There are times when it's time for me to speak, and there are times when it's time for me to pass the microphone to someone else because they know good and well what they need, and it is their time to speak for themselves, if that makes sense. We have lived in a world quite too long of us trying to do for others, and we never listen to what it is that they really needed or wanted. So I want to be clear about that. And just going back to Melanie, you all's motto of, not wanting to have a food bank exist ever again, that is so true. I think if poverty was, taken away from the world, that is literally the goal. And even though it seems huge, overarching, we all will be able to put our brick to that foundation. It may not happen till 1,000 years after we're gone, but my brick will be in that building, right? So whatever your brick is, make sure that you contribute it. We may not end it, but at least we are moving forward in a greater direction, and we're doing what we know is right. So that's my advice that I would say.
Thank you both so much. That's really great advice. And I will turn it over to John to close us out.
And Melanie and Parker, so much wisdom was shared here today from y'all. So thank you. So appreciative of all of your advice, your suggestions, and then just being able to be with us here tonight. I do want to close out on sharing a couple of things. One is, as I mentioned earlier today, Food Recovery Network was started by dreamers, by problem solvers, and we have a network of thousands of students who engage with Food Recovery Network every year, who are working to end food waste and hunger. And we need leaders like you more than ever, and certainly we all need to do more. So I hope that you will all hold on to the lessons here today around listening and imagination and building a more equitable world that is much more resilient than our world is right now. And thinking just about how devastated COVID-19 has impacted Native communities across the country, and how food insecurity, the rates there were just alarming and completely disproportionate. And the same goes for Black and Latinx communities across this country, that there's much more that we need to do to address racial disparities across this country. So we need to listen, we need to learn, and with 54 million people at risk of food insecurity right now during the pandemic, there is so much that needs to change. And we ask that you all will learn, improve your skills, enhance your ability to increase your impact, and I think listen to a call to action to find solutions to these problems that exist now, and they're not going to be going away unless we change them. So a really easy thing you can do is to next time we have a webinar in this food justice learning series, is to bring a friend, and make sure that you're doubling and mobilizing the folks who are hearing these messages. And as we work together to end hunger, I want you to also think about that this is it's Hunger Action Month. It's a big deal for Feeding America. They are really doing their best to, like Melanie said, to make sure that they're providing as much food as possible to communities that need that food. And if you are unable to do food recovery this semester because of COVID-19, or are really wanting to have a direct impact, it won't hurt to reach out to your local food bank and volunteer with them. I know that they're short of volunteers, and there's always a need there. Also, I hope that y'all deepen and raise your analysis around racial equity, particularly around the connections between hunger and racial equity, and the need to prioritize that analysis. You can't end hunger in this country without doing so, because of the deep disparate impact for Black, Latinx, Native, and other communities of color in this country. And we need solutions that address the problems. And then educate others. There's so much work that needs to get done here on racial equity. And Marlisa Gamblin from Bread for the World has been a true superstar in educating folks across the country, and definitely seek out the resources that she is provided in that space. And then policy. We talked about advocacy a lot. Advocacy allows for the ability to pull a lever that will affect thousands or millions of people. And we at Food Recovery Network are launching our first or second efforts into advocacy and working with the Fuel for Higher Ed campaign to address college student hunger. And Melanie mentioned this before, but nearly 40% of college students are food insecure. And so much of our work happens with college students that we really want to make sure that we're working to make sure that no college student is food insecure. And we hope that you join us in our work in advocating to address college food insecurity. And then our next food justice webinar in this learning series is going to be on Wednesday, October 14th from 6 to 7:15 p.m., similar to this time slot. We're going to be talking about solutions to farm food waste. And we hope that you all join us, and then also bring a friend as well. So thank you for joining us tonight. Please complete the survey that we just sent out, that Sydney just sent out, and we will use that feedback to develop future webinars and really improve our programming here. So one last time, thank you everyone for joining us tonight. Melanie, Parker, Sydney, thank you for this conversation. For folks who are saying that the link isn't available, don't worry, we'll make sure that you get the links in a post-meeting email that'll go out early next week. So we'll send out a recording of this webinar so you can share it with your network, and then also the link to the evaluation, and then also the registration link to the October 14th webinar. And thank you again. Please use your imagination, and we appreciate your time tonight.